of patients who oftentimes are homeless, who don't have a penny in their pocket. Now, you take care of anyone who comes into the ER. That's a requirement.
Right.
But each and every day we have to deal with these incredibly complex social issues.
But I disagree with you that the hospital also needs to address the social issues, and it does, because there are social workers, and if there's a problem or issue with a person at home, they have to come in, and just like they do with babies.
Sure, but medically, the person doesn't need to be in the hospital anymore.
Right, well,
you don't dump people on the streets, that's wrong. But
she wasn't in an extreme medical condition. She had a pretty good brisk walk to her. I mean, it's not, when they say dumping, I have a problem with that. We're not throwing, they weren't throwing people out that had just had a heart attack.
But the problem with most of those homeless is that they have psychiatric illnesses. So they do have
And so the question here is, how can we prevent this scenario from happening? Because what's happening across the country is there's no safety net for these people who have psychiatric illnesses. They're homeless, they have no money, and quite frankly, everyone in the country just throws their hands up and, oh, let the hospitals deal with it.
The homeless situation is the biggest hot potato issue that there possibly can be, because the hospitals cannot take care of them, and then there is no place for them to go because there's no funding.
How large really is this problem? Is this something that affects all of us out here?
There are nights in the emergency department where the majority of patients that I'm taking care of are oftentimes homeless, intoxicated, whether it's from drugs or alcohol. Certain nights.
You see it when the weather changes. Heavy rains, cold. I saw that in New York City when I trained. The city hospitals where I trained in New York City, when the weather gets really cold, boom, the homeless people come in.
And they become my friends sometimes. There are people who will come in on a cold night, and I know the only reason they're coming in is to get a sandwich
How
and
it
be in a warm
affects
bed.
you is that you won't get the emergency care that you need, because, and also the hospital may go broke because they're taking care of people who cannot afford to pay.
And this is why, we're passionate about it, because the problem isn't the individual. The problem is we need to address this as a country. We need solutions. And regardless how you look at healthcare, it eventually does become political. If you don't think it's a big deal, just take a look at what President Obama recently said.
In the last 8 years, premiums have grown 4 times faster than wages. An additional 9 million Americans have joined the ranks of the uninsured. The cost of health care now causes a bankruptcy in America every 30 seconds. By the end of the year, it could cause 1.5 million Americans to lose their homes.
So 46 million people uninsured in America. 1/3 of those under age 65 between 2007 and 2008 had a period of time where they had no health insurance. 1/3 of our population. And the problem is people don't think about health care or their insurance until a problem happens.
And then it's too late.
Yeah, absolutely. And the problem is it's real. I mean, especially in the economy, it is expensive. And especially if you're a small business or employer, like I have to get health insurance for my employees, which I happily do, but it is expensive and it is a real...
We talked about this before the show. The two of us, we have at least 10 employees, so we're small businesses. I mean, that puts a huge...
Well, let's talk about that then, Suchin, because of the 46 million, 14 million are people who can afford it, but they choose not to. A lot of times, they're younger people. Oh, I'm healthy, I'll be fine, until the car accident or until the cancer's found.
It's a gambling game. It is. It's sort of, that's how people look at it, rather than something that is as imperative as having homeowners insurance or car insurance.
You know, Suchin, what's so frustrating, it seems like this conversation has been going on, not for 10 years, but more like 20 or 30 years.
And now, though, it's a much louder conversation because people are losing their jobs.
It is louder, but when are we going to do something about it?
It's a huge discussion on Capitol Hill. No easy answers, which is why we haven't come to any great grand conclusions. And there probably isn't a perfect solution. But in a country where there are over 120 million visits to the ER each and every year, in a country where wonderfully, no matter who you are, you can go get treatment if you need it. That's a great thing. But once you go home from the hospital after that tragic accident, meaning you didn't expect it, and then all of a sudden you get that first bill, and it's $50,000. And your whole life you paid your bills on time, you have wonderful credit, but you decided, you know what, I'm young, healthy, I don't need health insurance. For the rest of your life, you're going to be trying to catch up from that one accident because you didn't have insurance.
And but I also think, and what I'm learning through this experience, because it's the first time I'm having to go out and get individual health care insurance myself, is that if you do the homework, it is a myth that health insurance is unaffordable. There are solutions out there. It's just overwhelming and really confusing for the average consumer.
Even for a doctor, I'm in the middle of redoing my insurance right now, and I'm trying to figure out deductibles and premiums and
good news,
limits.
Jim,
and
we're going to cover that in the show today. So if you're at home and you're like Jim and you're debating your insurance plan, we're going to cover it. Stick with us, Jim.
Take notes
Stay here, buddy.
They don't teach us about insurance in medical school.
No,
They don't?
No,
We're doctors.
We're going to talk about this later. That's the point. Until we got out of medical school, I never thought about health insurance.
Right.
But now I do. Sue Chen interviewed a longtime reporter at Time Magazine who has a very unique personal perspective on the healthcare crisis.
So this is the cover.
Yeah, I'd never really done a story before where my own family was the story, and that really is my brother's pill bottle. Last year, my brother suddenly, out of nowhere, developed a severe kidney problem. The insurance company suddenly declared that what he had was a pre-existing condition and that they weren't going to pay a penny for it.
Walk me through some of the surprising things, even after covering healthcare for 15 years, you discovered with your brother.
Well, my brother had made one gigantic mistake. He had gone out and bought the best policy he could afford, but really didn't have a sense of how little coverage he was buying with that policy. When you've got a $2,500 deductible and you're making $9 an hour, which my brother was, you're going to have to pay for it out of your pocket. When somebody you love is in a life-threatening situation, you should really be worrying about getting them well, not about how you're going to pay for getting them well.
Karen's story brings up a really important point. Millions of people are underinsured, and they don't even realize that you must be an educated consumer. This is exactly what we were talking about. You need to look at more than just the deductible. You need to look at more than just the co-payment. We're going to talk to an expert later on to find out how you can pick the right plan to avoid your own disaster. Now, coming up, Sue Chen and our cameras followed one family through their daily struggle as their own medical crisis turned their lives upside down. And then later, we've got the top experts here to answer all your toughest healthcare questions, from which policy to buy to secret tips on how to save money. We're giving you solutions today. Don't go away.